talk to your colleague at the Ministry of Health. We can support you with equipment under the program. We do fee for service, so that some of the expensive equipment you don't have to buy.
Yes, sir.
The manufacturers, they come and put the equipment here.
Yes, sir.
And you only pay for to use. For every usage, there is a fee, and that fee can also be paid for by SHA. So it will make it easy, so that you don't have a heavy overlay of finances. You know? Because instead of, and you see, what we have agreed with them is that they will place the equipment, they will service the equipment, so that we don't have this problem that the machine meharibika, and we wait for a month, 2 months looking for spares all over the place. It becomes the manufacturer's responsibility to make sure that the equipment is working, because that is how he will make money.
We are going to engage.
Yeah.
We start.
You had actually guided as such.
Yes.
We had an initial meeting with the PS of health. So we are actually progressing what you had guided.
Yes. And already, I think 20 county hospitals have those facilities. So we are, it's another way of innovation.
Yes, sir.
The manufacturer wants somebody to use their equipment once they have manufactured. So we are, but also when you don't have money, you cannot buy. So he's stuck with the equipment, we are stuck with the patients. So it's a win-win.
It's a win-win.
Yeah. So I think that would be my other advice.
We'll explore that.
We have engaged actually now. We are now coming with the SHA now. It will be much easier to pay those equipment. We have engaged. We are at advanced stage since you guided us the other time.
Now, Your Excellency, before you leave, I would invite you for a demonstration of how that linkage with SHA through Taifa Care.
Okay.
Yeah, right here, sir. Right here, sir.
Oh, sorry. Oh, yeah.
We have already deployed RPKE in this facility, and we are paperless.
Because you see, that documentation on paper is the one used to bring us very many complications with claims, with fake claims, fraudulent things. But now, when somebody is identified, either we are moving, of course, to biometric, but now by ID. So when somebody with their ID, we make sure that there is, yes, you identify them, and OTP. Because now OTP makes sure that this is the person who is carrying the ID. So it is, it's helping us remove unnecessary fake people. So, thank you.
So, Your Excellency, sir, I am Dr. Joyce Wamishe from the Digital Health Agency, and together with me is part of the team, the product development team, represented by Jared Onsomu and Marvin Gondi. And it's like you were with us when we were developing this demonstration. So Taifa Care is what we are rolling out, and it's a user-centric solution that is integrated to the digital health superhighway. We have been at this facility for the last couple of days, training the staff. They are really enthusiastic about it, and we've also been configuring it to be able to see both military personnel and civilians who are SHA eligible. So the plan is to have this system deployed to all the military health facilities countrywide, and we are looking forward to this particular facility being the model facility that goes paperless. As you've alluded to, this is the homepage, but you have rightly described the identification process. So we ask for the national ID, and I'm describing for the civilian that are SHA eligible. We ask for their ID, and we are definitely making sure that we are not dealing with a ghost. We are dealing with the true person that we want to serve. We also can see that they are SHA. Exactly. And then after that, they have registered and done, they're eligible, they can get services under SHA. After that, we queue them to the triage, And then at triage, this particular system has got clinical support alerts. For our patient today is Marvin, a 32-year-old male, and we can already see once we put he has fever, so the system is even saying this person is febrile. We are also able to see that this is a person who needs to be fast-tracked in terms of triage compared to somebody who's a bit more stable. Then we take them to the consultation room, where we can see this. We had pre-filled this, but we can see that we can see the patient physically, and we can, today we put in some more information at about 5:50 a.m. And here the clinician is able to take care of the patient, do a very good, and then do any lab radiology. The history, so the patient will give us the history. The past histories, they're already in the system. And then when they come,
So that
exactly.
that used to be in the exercise.
That exercise book imepotea. Hakuna makaratasi. Exactly. Yes, exactly.
You know, the exercise book disappears.
Inararuka.
And then they have to start from zero.
Exactly.
But now,
Yes.
in terms of losing history,
Yes.
which hospital they've gone,
Exactly.
what medicine they've been given,
Yes.
what treatment they've gone through. So you have the benefit of that history
Yes.
right at this.
At this. Exactly.
Without people carrying pieces of paper all over the place.
You're very right, sir. We actually say we want some.
There are people who have an argument with this thing.
Oh.
What argument are we having?
Yes. We want someone to give their history once. And then after that, it's just building. Exactly. So for today, it's a short patient journey. We then prescribe some medication. And then the patient goes to the pharmacy without any paper, no prescription, and finds the pharmacy. The pharmacy view is like this, and the pharmacy is able to dispense. Now, Your Excellency, after that, the patient goes for discharge from the patient journey to billing, where another OTP is done to say now the patient journey is complete. And then the bills have been accumulating as the patient moves from one service delivery point to another. So at the billing, the patient is discharged from the patient journey, and then the various bills are put together. There is some verification before we move it to the SHA for processing. One of the hallmarks, Your Excellency, for this system is tunasema data mkononi. So this is a dashboard for the facility. So the leadership will definitely appreciate this kind of dashboard, because the CMO will be able to know how many patients have come over today and over the past 7 days, and we can even configure over quarter, over the last 1 year. We'll be able to know our patients who are coming, what are they sick from, you know? Here,
What's the disease?
yes, exactly. So the bigger the writing, the more common it is in this facility. And we can even do this for surveillance. So like, remember the time we had COVID? COVID most likely came even before that March. We would pick it with this system earlier. When it comes to collections, we have, as I said, we have configured to be able to see military, but now we also have SHA, and we can be able to see the collections via whatever scheme that the facility is having.
These also, helps the hospital to plan ahead what kind of medicines.
Exactly. Exactly. Spot on, Your Excellency. Here is the pharmacy place where you can even see how many of those prescription orders have been fulfilled. So you're able even to know which are these medicines that are not being fulfilled, and we need to get them in this particular place. So with that, Your Excellency, we definitely feel your leadership. We really, really appreciate, and that's the end of this small demo. And we look forward to this facility being paperless and guiding the way for the other military health facilities. Thank you very much.
I'm very happy with this.
Thank you.
This
Thank
is
you,
what
sir.
I believe.
Thank you, sir.
And it's going to happen.
It will
This
definitely
will happen.
Yes.
Yeah. Makelele aside, this will happen. Okay, thank you very much.
Thank you so
I'm
much.
sure the people who have been handling papers, I'm not hearing them talk.
Your Excellency,
People
we
who
are
have been
here.
handing around these papers,
We are more than excited. We have trained every member of staff.
Yes.
We have brought out the system.
Yes.
And we are happy that we don't have to lose prescriptions today. Whenever whoever gets medications from this facility only gets that which has been from the system. Yes. There are no side routes. No side manenos here. We are more than happy, Your Excellency.
place to place. So, yeah,
Sasa hiyo file.
The beauty of the system also is that you have visibility of this across the regional hospitals. So that a patient senior, the file is available in the other regional hospital. Yes, sir.
Dr. Lanet is from the Ministry of Health. She started her journey in our hospital.
Okay.
She's our intern.
Okay. Okay. Very good. Very good. I was talking to your team, the DHA team, last night. Just trying to tell them how to configure so that we can be following the numbers. So it is moving very well.
We now transition to the launch of the UPHF fund, sir.
So this fund, this is a national government fund which was approved by the cabinet, and it has also been approved by the National Assembly so that we can contribute to universal health coverage by attending to civilians in our level 4 to 6 facilities at AFISA, primarily through Social Health Authority, private insurances, and other schemes. Yes, sir. Our clientele will be civilians, varied civilians. Even Mama Mboga will be able to attend here, sir. Then this, yes, sir. Yes, sir. Then we have the level 4s, sir. We have 6 level 4s currently, as listed here. Then we have Defense Forces Memorial Hospital and our envisaged level 6. So this facility, this fund is governed and administered by the Defense Council as the supreme organ, which gives the policy direction. And we also have an advisory board, sir, which gives technical advice. The advisory board is chaired by the Principal Secretary, who is also the administrator of the fund, Principal Secretary, Minister of Defense. The senior most person there after the Principal Secretary is the Director of Medical Services, who is a uniformed personnel. So we also have diverse technocrats from other ministries. We have from the National Treasury. He's out. He sent his apologies. He's in Wajir on another assignment. So we have the DG, Minister of Health, Dr. Patrick Amoth, who has graciously visited us today. And so we also have the Director, DG. Then we have Director of Military Veteran Affairs, representing the veterans, Brigadier Leriari. We have the Chief of Finance, who is also there. And then so we also have the non-uniformed personnel, who led by our Director of Human Resource Development and Management, Madam Dr. Nzavi. We have the Chief of Medical, sir, also there, gracious. And we have the Senior Chief Finance Officer. They are all available here, sir. They have really guided us in the initial preparation of this launch. So the Secretariat is headed by me at the moment. So,
do you mind some feedback?
Anytime, sir. Anytime.
Unless, do you have a reason why you have the prime there?
The prime, sir, is essentially because it will be superior service. We are anticipating superior.
Superior service is not in the naming.
Yes, sir.
It is in the doing.
In the doing.
But yes, but it is in the doing.
Yes, sir.
I think, because you see, I'm just seeing the way UPHSF.
Yes, sir.
is a bit mouth.
It's mouthful.
So just think about it.
Guided, sir. Guided. So we have
Yes, Patrick, how are you?
the Director General. Dr. Nzavi, Dr. Ngundo, then Mr. Mutuma, Senior Chief Finance Officer. Sir,
How are you, Professor?
our stakeholders, sir,
Yeah.
is the CEO,
Hello.
then Brigadier Limo from Defense Force as well, sir, and from Defense Forces Medical Insurance Scheme. Sir, after that, we request, sir, that you press on the buzzer so that we can unveil the plague.
And now, His Excellency will launch the fund in 5, 4, 3, 2, 1 now.
We've made about 50 million.
Oh, very good.
Yes, sir. So I will request that we take a photo, you on this side. After the light, sir, we wait for this. Yes, I will take a photo. Thank you. Thank you, sir. The PS, on this side, sir. DMS, sir. Dr. Patrick Amon. Thank you, sir. That's the end of the tour. Thank you. Thank you, sir.
Thank you very much, Your Excellency. Launching officially the fund advisory, the fund. Thank you, Your Excellency. We may now replace our referees. Your Excellency, I now kindly invite you to unveil the plaque and officially open the Lanet Regional Hospital.